We were faced with the theme of the hackathon was the underserved, and the problem at hand that we were trying to tackle was that of the care of the homeless. So we focused on the major pain point that a lot of homeless end up in the emergency room, and they end up getting uncoordinated care and short-term solutions, and this ends up costing the system billions of dollars eventually. So we addressed that using a geolocation services. Maybe you want to talk about that, Nate?
Okay.
So if you look at the city of San Francisco, they identified 200 individuals who spent $40 million on emergency and ambulatory services in 1 year. And it takes them 2 to 3 months to discover who these people are because their systems don't talk to each other. So we decided to use location data to help connect the dots between when this overutilization is happening. And not just location data, but to actually have that speak to their primary care coordinator. So if someone is visiting the ER room multiple times, their care coordinator is notified and can work on a solution with that person and intervene right away rather than waiting 3 months when it's too late.
Okay. And so is it as straightforward as it sounds in practice, carrying that out with your tool?
So what we set up was the ability to geofence a location, so an emergency room, a needle exchange, a clinic, and the idea is that there's an app that the patient can opt in with their care coordinator, and it's a communication tool. So the idea is that if you're incoherent or you're not in a situation where you can communicate, someone who's looking out for you can find out about this and can intervene. We can send a care team out to help you. Again, this was a 2-day project, really. We all just met, but we built a live demo where we geofenced a location at the hackathon, and Jackie, who's our engineer of this piece of the project, ran off down the hallway, and when he got there, it triggered a text message to his care provider, which happened to be one of the judges, notifying him that his patient was in need of help.